Welcome to the Healthcare IT Today CIO podcast. I'm John Lynn, the founder and chief editor at Healthcare IT Today. And I'm excited to bring you the most exciting and practical healthcare CIO insights and perspectives. We know your job is challenging. We want to help you be more successful. And our guest today is Muhammad Siddiqui. He's Chief Digital and Information Officer at Reid Health. Welcome, Muhammad.
Oh, thank you. John, thanks for having me. I've been following your podcast for many, many years, and this is the first time an opportunity. So thanks for that.
Yeah, I was going to say, I've tried to get you on for many years and schedules never quite aligned. So
Honor's all mine.
Thanks for taking your time out of here at Chime Fall Forum, to do this. But, I want to dive into the discussion, but tell us a little bit about yourself and Reid Health.
Sure. So my name is Muhammad Siddiqui, as John said. We are a small rural health system based in Richmond, Indiana, which is the south of Indianapolis, around 45 miles on the south. If you go out on a little bit more south, maybe 5 miles from our hospital, we're going to be into the Ohio. So That's where we are. We are 274-bed hospital with a very strong hold on ambulatory care centers. We have around 65 ambulatory care centers plus multiple urgent care centers that we serve around 45,000 community members for the Richmond, plus 9 different counties between Ohio and Indiana State.
It's interesting when you talk about the population. That doesn't sound so rural to me. But I think it's the reality for many rural health organizations. They have a big impact just across a larger area.
Absolutely, John. Because if you go 45 mile and 50 mile left, right, and front, there's no other hospitals available. So we really are truly serving the community that really deserve to be served.
That's awesome. Well, talk to us about how you're approaching cost optimization from an IT perspective. I think it's an important discussion as budgets are being cut.
Absolutely. I think the external factors are really hurting the healthcare system today. The reimbursement is bigger there as well. Medicare and Medicaid or medical advantage issues are coming in every single health system as well. Turnover, burnout is the feature there as well. That's also impacting big in our financial storm as well. What we do and what I recommend my CIO folks to do, basically look at every single contract that's out there and see what opportunity that you have there. Look for operational efficiency. How can you help an organization to create a more capacity, whether that can be in OR room, would that be in ambulatory care center, could be in a primary care center. How can we leverage the technology to be able to bring more patients to the front door and be more accessible for the patient they really need help with?
Interesting. And how do you do that from a budgeting standpoint? It's kind of a weird time, I think, in healthcare technology for a CIO leader.
Right.
How are you approaching that budgeting in this kind of uncertain future, I think is what I'd describe it as?
That's correct. So to be honest with you, don't look at IT anymore as a cost center anymore. Technology is here to help. Technology is the only remedy that what I think today in healthcare who can get us out of the crisis that we are in today. That's what I looked at as well. So we need to look at every single project that we involved in. We need to look at what would be my ROI? Is it telemedicine? Is that something I need to spend more? Is virtual nursing care? Every single hospital today are short 100 plus opening for the nursing. Is a virtual care really going to cost me less money even than hiring a nursing shortage? Do I need to turn away a patient because I don't have a staff? Right? How can I reduce the turnover? Right? How can I reduce the burnout? Technology is the key driver to solve probably all those issues that I talk about.
Interesting. That's really cool. And I think, another thing that I've heard you worked on, so I'd love to learn more about it, is, that, you've made investments, as you kind of mentioned, and you have your team looking at those. How should a CIO approach kind of maximizing those current investments, those current technologies?
Oh, that's an excellent question. So my team in Reid Health, we just gone through for the last 7 months an Epic Refuel project. And what Epic Refuel is, basically, is to look at it. Did you really turn on every single feature for the Epic? Are you really maximizing your investment that you have made with the Epic? So we started this project last year in January, this year in January, and we did the assessment, and guess what? We look at it and see 850 features in Epic, which is robust features, is not even turned on. And that's what we call Epic Refill Project. So team work very hard. We use the Agile framework. We have a 2-week sprints, and we gone from Gold Star 3 to Gold Star 9 in less than 5 months.
Wow.
And this is a great achievement by the team. And the secret ingredients is project is run by the providers. It's not run by the IT project.
Wow.
And that is my recommendation to my fellow CIOs, run IT projects as a backseat, not a front seat.
Oh, interesting. Is there a technology that you're kind of keeping an eye on right now that you think will have an impact soon?
I think we are focusing too much in digital health. I think we're focusing too much in cybersecurity. I think the one thing we probably not focusing nowadays is hospital at home. I think it's coming. It's gonna come just like, remember, if you go back to 2021, I always thought the telehealth milestone I'm not gonna see till 2029. I think this is probably gonna happen for hospital at home as well. It's gonna come so fast. Payers are going geared towards this as well. Insurance companies are pushing to have this because obviously the cost pressures are coming for them as well. I think we need to be ready for that.
Interesting. So how does a CIO ready for that? Is it about creating partnerships? Is it about sharing data? Is it about launching new products? Or?
So to be honest with you, John, we cannot do everything ourselves. We really have to rely on our partners. Partner has to come in the skin to work with us to find the solution and cost-efficient ways.
Interesting. So we always like to wrap up these CIO podcasts with a little career question, some sort of career perspective. But for you, what was maybe the best piece of advice that you've been given in your career?
I think we need to start thinking about out of the box. We need to create a new box for your career. That's exactly how we need to think at it. Myself, personally, I started out back in early days. I started as a PC tech and move up to the ladder to become a chief information officer now. So my recommendation to you, take your time, but don't think out of the box. Create a new box of opportunity for yourself.
Awesome. Well, Muhammad, we've wanted you on for a long time. I appreciate you coming and sharing your experiences and perspective. And thanks everyone for watching and listening. If you want to find more great healthcare IT content like this, be sure to check it out at healthcareittoday.com or search for the CIO podcast by Healthcare IT Today on your favorite podcasting applications. Thanks, Muhammad.
Thank you.